When I was a younger guy, I always call myself the fire-breathing dragon because I was trained with people where in the in days past, surgeons were, especially where I trained, were put on a pedestal and they were catered to, and they got away with things that really don't work anymore. I would say when I was younger, I didn't really understand that residents weren't as committed now as I was when I was a resident, and I railed against that and tried to change the behavior, but that was a generational thing. I didn't really understand it. Now I totally understand it. Of course, now, I'm far into the game. I've made all the mistakes in dealing with people, which is probably why I was a CMO for a little while. But um, yeah, I mean, I've seen all the stuff for the most part, or anything that comes now is a spin on something I've seen. So I remember where I've made a mistake in handling it for the most part and try to do it a different way if it didn't work historically. So in that sense, yeah, and I'm probably a little more laid back. I'm not, an easygoing kind of guy, and I have high standards, but I've gotten better at bringing people along to that level rather than hitting them on the head with it and expecting it. That doesn't work anymore. People don't remember everything that you say, but they do remember how they've been initially handled, and I think there's a lot of merit to that.